that class is why we, as health system pharmacists, should not recommend that our diabetic patients enter hot dog eating contests.
Now, do you guys have any questions for me?
Oh, hot dogs. Dr. Oldman, you seem to really know your stuff. How long have you been a health system pharmacist?
Now I think about it, it's been about 50 years. I think actually it's time for a flashback. I was just a young groovy whippersnapper back in the 60s. The healthcare system was changing for health system pharmacists and everybody else. ICHP was founded back in 1963, and Medicare and Medicaid were passed in 1965, which provided healthcare access to a lot of people that didn't have access before. Then in 1966, ASHP held its first mid-year clinical meeting, which we all know is an important conference for pharmacy students looking to find a residency. Believe it or not, I attended that first mid-year meeting, and that's actually the first time I met the woman I'd eventually marry. The 70s was a funky decade and an interesting one for health system pharmacists. In 1974, the Accreditation Council for Pharmacy Education updated the standards for the inclusion of clinical clerkships in the education of new pharmacists. And then in 1977, California became the first state to enact legislation granting pharmacists prescribing rights. Finally, the American College of Clinical Pharmacy was established in 1979 to help clinical pharmacists define their role in healthcare. Also, if I remember correctly, my best friend Steve from 4th grade started up his new software company back then. You know, he wanted to name his company after a vegetable, but I convinced him to name it after a fruit instead. The 80s were a wild time full of neon clothes and big hair. My best friend Oprah from 8th grade got her own TV show back in those years. Who would have known that it had become so popular? But I think a lot of people tend to overlook the fact that the 80s is when health system pharmacy really started to become what we know it as today. To start with, in 1980, ASHP introduced clinical pharmacy and specialized pharmacy residencies. This really opened up a door for a lot of pharmacy students to be exposed to areas of health system pharmacy that they didn't know even existed. The NAPLEX exam was first introduced in 1986, so you can thank the 80s for that. Then, in 1988, Hepler and Strand presented their historic paper that defined this new idea of pharmaceutical care. And as we all now know, this idea is a pivotal part of what we pharmacists strive for every day now. I'll admit that the 90s were a bit fashion awkward, but again, let's focus on the positive here. OBRA was passed in 1990, which allowed us to establish Pharmacy and Therapeutics Committees, or as you guys may know them, PNC committees. It also let us start substituting generics for the brand name drugs, which I'm sure you guys realize is really nice for our patients. 1994 was the first time pharmacists started immunizing, which was great for pharmacists, but horrible for me since I'm terrified of needles, even if I'm the one administering the injection. Also, my best friend Michael from high school started winning basketball championships with Chicago during the 90s, and I suggested he should try his hand at baseball, but I don't really think that worked out very well for him. And finally, we enter the new millennium. Now, after everyone got over their Y2K scare, and I finally got the refund on those dozens of Y2K emergency kits that I bought, Medicare Part D was passed in 2003. This helped us health system pharmacists out because it helped our patients in terms of the options they had for drug treatment. Then, in 2004, the American Association of Colleges of Pharmacy endorsed medication therapy management as an integral part of the pharmacist's role. Nowadays, MTM is critical for us health system pharmacists because this is where we can really maximize our skill set to help our patients. Then, as of 2008, there are 45 states that allow collaborative drug therapy management. For us, that means that we can provide more streamlined drug therapy for our patients. Did I miss anything?
Dr. Oldman, how come you haven't aged throughout all these flashbacks? Yeah, how old are you?
Guys, let's not worry about how old I am, okay? I'm definitely not 1,000 years old. I just have a really good anti-wrinkle cream, and I lather my face in honey from the Amazon every night. So, I'll just see you guys on Monday, okay? Have a good weekend.